Brad,
Hi.
how's it going?
Good.
Good, I'm Kevin.
Well, nice to meet you, Kevin.
Nice to meet you. I am a student therapist. I'll be working with you today. Dr. Purcell will be supervising for us.
All right, great.
How you doing?
I'm doing great.
Yeah?
Yeah, appreciate your time here.
Oh, no problem. I'm glad I could come and try to help you out.
Yeah, I hope you can.
Yeah, me too. So, let's start with you for a minute. Where are you from?
I live in Springville. We've been here about 15 years. I work from home for the most part. I'm a computer programmer.
Oh, okay.
Yeah. And my wife and I are empty nesters as of about a year ago. Our youngest child got married and nobody's here anymore.
No, nobody's here. How's that going?
It's going well. Yeah.
Yeah?
It's a transition, but we've actually enjoyed it. It has its pluses and minuses.
Okay.
Yeah.
Yeah, I hear both sides of the spectrum on
Yeah.
empty nesting. Just so you know, I will be taking some notes just so I
Okay,
can
great.
keep track of what we're talking about. But let's see. Your form says you're in here for your ankle.
That's right.
Yeah.
Yeah. Basically, when I go on extended walks, the right front edge of my ankle gets very sore. It's like a burning flame pain.
Okay. And you said extended walk, so what does that mean? How long?
Roughly when I'm starting to approach an hour or so that might be 3 miles, 2 or 3 miles, probably closer to 3 miles after an hour, but roughly an hour of walking, it starts getting quite uncomfortable where I'm thinking I should get off of it.
Okay. Is that something that you do frequently, is walk for that distance?
Not at all now. I kind of avoid walking now because of that.
Oh, okay. So it's been painful enough to keep you from walking.
Yeah, there's some other feet issues we might talk about also, but that's the primary one that I feel right now.
Okay. So let's see. I kind of want to hear about these other feet issues just in case.
Okay, well, I did have plantar fasciitis about 3 years ago, and that lasted about 6 months. It's after I was going up and down a ladder several times with a lot of weight on me,
Okay.
and it really flared up on my right heel, and it lasted about 6 months. So that
Okay.
definitely slowed me down from doing exercise, walking. And then I started getting a pain right around here on my foot. And I think it's cuboidal syndrome, but I'm not sure, but I know it's in that vicinity. And,
Okay.
And it was really bothering me on my left foot actually, and that's pretty much subsided. I got some Happy Feet insoles, and I think it helps a lot. But now I'm starting to feel little twinges of it on my right foot.
Does the right foot have the insole?
Yeah, both of
It
them
does.
had insoles.
Okay. Okay, just checking. Some people don't do that.
Yeah, well, you know what's funny is I had some Air Nikes and the left one deflated, and I kept walking on the treadmill. That's when my cuboidal flared up the first time. On my
Oh,
left
really?
side. Yeah, because I tried walking with it deflated.
Okay.
Wasn't a good idea.
Not good. All right.
No.
Yeah, shoes
I
are
never do that again.
shoes are important. I learned that myself. Had some foot problems myself. So, okay, good to know. I want to go back to that ankle. You said burning when you walk. Is there any other activities that cause it to flare up for you?
I really don't have any activities other than walking, and as of right now, I'm very sedentary, so
Okay.
it would not affect other activities because I don't do them.
Okay. Yeah.
I was
Did you
just
wanna say
going to say, if I do activities, it would be in the form of walking or hiking. So
walking or hiking?
yeah, so that has curtailed my desire to do it.
Okay. So you do some hiking. Hiking's a little more rough surfaces to walk on, so
Yeah,
that's
but
important.
that's
Build some strength.
very, very little, but yeah, that's a form of activity when I do it.
Okay. How long has this problem lasted?
Well, it started in probably around, where it really started bothering me was around May of 2018.
For a while then, maybe
Yeah.
2018.
Yeah.
Okay.
And like I said, it's not chronic, but when I start going on long walks, it definitely flares up and hurts.
Okay. So from May of 2018, has it increased in pain? Has it gotten worse since then?
I would say gradually. It's not an incredibly painful pain, but I think it's gradually increasing as I get older and as time goes on.
All right. And, oh, sorry, go ahead.
Not much more there. It's just it hasn't. it's not like I can feel it ramp up, but I just think it's kind of getting a little worse as time goes on.
Okay, good to know. What makes it not hurt as much?
Mainly rest. Don't walk on it. It's fine. And then like I say, just walking around the house and things. Sometimes I feel it, but it doesn't really hurt.
So it zings you sometimes, or?
No, not a zing. It just builds up. It gets hotter and hotter feeling.
Oh, okay.
It never is a sharp pain.
Okay. Have you taken any medications to address the situation?
Recently, I went with my boys on a southern Utah hike, and I did take ibuprofen, and it seemed to help.
Okay.
It did seem to help.
Is that just the one time you take an ibuprofen, or is
That's
that...
the one time I specifically remember. We went out for 2 days, and I took it both days, and I seemed to be okay ankle-wise.
It was okay.
Yeah, it was
It
okay.
helped.
Yeah.
Okay.
I don't think it completely stopped it, but it made it so like it was totally bearable.
Okay.
It doesn't get unbearable, but it gets very uncomfortable.
Right. Okay, good. Have you gone to a doctor or anything to get it looked at?
No, I've never done that.
Okay, so that mean never had it x-rayed or anything?
Never have.
Yeah, okay. Let's see. Is there any other medications you are on that would be important for us to know about?
Nope.
Any at all?
I'm on no medications.
No medications?
No.
It's impressive. Good job.
Thanks.
Do you have any family history, medical family history that we should know about?
The only thing that would relate to my joints, I would think, is I have a sister who has rheumatoid arthritis. I don't believe I have it, but she
Okay.
does. But other than that, I think the family joint history is quite healthy.
Pretty good.
Yeah, and muscle history, yes.
What about things as far as cardiovascular or cancer or things like that?
Our family has very little history of that. We do have some anxiety and depression, but not cardiovascular.
Okay. Yeah. So you mentioned you're a computer programmer. So you're not moving around much during the day. Are you at your desk?
I'm almost totally in a sitting position. Actually, now that you mention it, when I sit at a desk, I do get pains back here. So right now I sit in a lazy boy.
Okay. You do get pains that you said back here in the neck.
The upper back, lower neck area.
Upper
Yeah.
back,
So
lower
I avoid sitting at a desk because
Okay.
it's probably poor posture that led to that.
Okay. And then at home, you live at your house with family, with your wife.
Just my wife.
Just your wife. Oh,
Yeah.
right. You're an empty nester, of course. Do you have a lot of stairs that you climb up and down at home?
We have 14 stairs,
Oh,
but I don't go up and down a lot, but I do go up and down them.
you do. Is that like a daily thing, or?
Just to go downstairs and work and come upstairs. So maybe it's, six times a day, maybe?
Okay.
Maybe.
Well, that's a decent amount, so that's good to know. You've mentioned that you have stopped walking, and that was in some hikes, and those are your really only your physical activity that you did, right?
Walking. I used to walk on the treadmill as exercise on a quite regular basis, but then when my feet
Okay.
started bothering me, I backed off because I felt like might be doing damage to my feet, and it didn't feel good.
Okay. And is there any activity that you used to do, any other activity, I guess, that you used to do that you have stopped that you would like to get back to?
Not really. I mean, I used to play ball, basketball and stuff when I was younger, but those days are long gone, so
Okay.
I don't miss that or do that.
Okay. Alrighty. So going through your charts, I just noticed that you mentioned that you were dieting.
Yeah.
Can you just explain more about that?
I started my keto diet about 3 years ago, and I was very diligent with it, and I lost a lot of weight, probably around 60 pounds.
Okay.
But I've gotten more sloppy, especially as holidays and vacations have come around, and I put on probably 35 of those pounds back, and I've started up again rather diligently. So
Okay.
it's basically high protein, high fat, low carb diet.
Okay. So you're back on that diet.
Yes.
Do you feel like keto, there's a lack of carbs, does that ever get in the way of you exercising? Get
I don't
dizzy
think
or
it ever
anything like
has.
that?
I have been lightheaded. I don't know if that's because of the lack of carbs or because it lowers the blood pressure, but I don't think it's from lack of carbs that I feel lack of desire to exercise.
Okay, good. Real quick, you've mentioned your foot. Is there any heart or problems that you've had before that I should know about?
No, I'm good.
Breathing?
Nope, other than I'm not in good shape.
Okay. And any skin problems that you, moles or?
No, I went to dermatologist a while
spots.
ago and he said I had good skin for my age, so I think I'm okay there.
Okay. So the last thing I want to cover is after physical therapy, we want to set some goals for you to work towards. What are some goals that you have in mind?
Well, I definitely want to increase my walking again, and also in my old age, I really think it's important for me to get better leg strength for balance.
Okay.
I know now that I'm more susceptible to falling, but I don't fall, but I feel like I'm at risk now.
Okay.
Even going up
That's
stairs,
good.
I hang out of the handrail more because I feel less steady going up and down stairs. So I really think I need more leg strength and
All right.
balance.
Okay. Well, that is something we're definitely going to work on with you. That and getting you back to longer walks. We'll get your hands on my hands on your ankle, and we'll figure this out.
All right, great.
Okay.
I'm looking forward to it.
Awesome. Thank you for time. Let's move on.
All right, thanks, Kevin.
Okay.